I think we're going to wait maybe just one more minute to see if anyone else joins. Okay, we're going to go ahead and get started. So today's webinar is going to be school-located vaccine clinics, and it's going to be presented by our Community Vaccination Program Specialist, Bridget Anthony. Today's date is March 5th, 2024. So we're just going to go over a few of the housekeeping items. Next slide, please. So for all of the QA members, please monitor the chat for any questions that you may be able to answer. And then for all attendees, just be assured that today's session is going to be recorded and posted to our website via the link here. Any questions should remain either in the chat or and will be answered at the end of the presentation. In addition, for both QA team and the attendees, please ensure you are muted throughout the presentation unless you are speaking. And if you do have any other questions following the presentation, you can always email us at hawaiibfc@doh.hawaii.gov. Next slide. As I mentioned, during today's webinar, please use the chat to ask any questions you have so that the Hawaii VFC program subject matter experts can respond directly. And any questions you do have will be answered at the end of the presentation. So I'm going to have Bridget go ahead and get started. Thank you.
Good morning. My name is Bridget Anthony. I'm a community vaccination program specialist at the Department of Health. So like she said, this presentation is about school-located vaccination clinics in Hawaii. So some of the objectives that we're going to go over today is defining school-located vaccination clinics, talking about the benefits of these clinics, discussing our previously implemented Department of Health Stop Flu at School program, and then reviewing the next evolution of this program and also summarizing the 2023-2024 Stop Flu at School efforts. Next slide, please. So what is a school-located vaccination clinic? So they're typically administered on school grounds via temporary clinics. They're primarily designed to vaccinate enrolled students, but some providers have also been known to vaccinate staff and family members and outside community members as well. They're typically held before, during, or after school, but mostly during school hours or after school hours, like 3 to 5. And then typically also involve the collaboration between state and local health departments, schools, and other groups such as federally qualified health centers, pharmacies, healthcare providers, and community-based organizations. And then they're typically held during the influenza season, which would be October through December. Next slide, please. So why do we promote these school-located vaccination clinics? So they're a critical access point for students and school staff and even family members to receive vaccinations. They're typically given in schools, which are environments in which children feel safe and seen, soothed, and secure, which can improve the immunization experience, and it's more convenient for students during school hours rather than going to your doctor's office on the weekends or during the week after school hours for parents. And then principals, teachers, and school nurses are trusted sources of information for the community as well. Next slide, please. So what does this school-located vaccination clinic typically look like? There's no one-size-fits-all approach to these clinics. Each school is kind of different. They have different needs and different community resources to draw on. So some schools can use their existing healthcare resources like school health nurses to deliver vaccines, or if they have like school-based health centers like Waianae Coast Comprehensive has a few, or schools can partner with like local pharmacies or federally qualified health centers or healthcare providers to host these clinics. So typically what the process looks like would be first starting off with school recruitment to find out which schools are interested in having these clinics. Then you would partner with the vaccine provider, which would be like Kaiser or PharmaCare to provide the vaccinations. And then you'd move forward with scheduling the clinic in coordination with the providers and the school leadership. And that includes things such as like parental communication, distributing consent forms, and reviewing the consent forms. And then we move on to like implementing the clinic date. And then after the clinic date is complete, we also review like clinic data and outcome evaluation. Next slide, please. So some of the benefits of a school-located vaccination clinic. First, it allows the ability to immunize large amounts of students in a short period of time in a familiar and comfortable environment for the students. It also decreases illness-related absenteeism for school students and missed work for teachers, school staff, and families. It also reduces barriers to underserved students by making vaccinations convenient and more accessible. It lowers disease transmission and hospitalization rates in the surrounding communities, making it a healthier community. And then it increases coverage of school-required immunizations and keeping students up to date on all recommended vaccines. And it relieves the seasonal burden on providers, such as in preparation for the new school year or flu season. Next slide, please. So I'll talk a little bit about the Department of Health Stop Flu at School program. So we launched it in 2007. It was a statewide school-located influenza vaccination program that offered seasonal influenza vaccines without cost to students with parents and guardians' consent in grades K through 8th grade. The objective was to decrease influenza disease and complications resulting from influenza in school children. However, it was suspended in 2021 as a result of resource and staffing constraints that were exacerbated by the COVID-19 pandemic, which led to the suspension of this program, and also the emergence of community vaccination providers that became capable of conducting these mobile or offsite vaccination clinics also has paved the way for a more feasible alternative to these traditional Department of Health run clinics. So although the program was suspended, we still are committed to providing guidance and support for school-located vaccination clinics as an effective mechanism for protecting students from disease and keeping them in school. Next slide, please. So this is kind of our next evolution of the Stop Flu at School program, how we're promoting our vaccination programs, these clinics. So you would reach out to me if you are a provider and you're interested in partnering to conduct a vaccination event. My information is below. And then we're starting to begin the process of sending out the Department of Health school survey, which we're trying to determine which schools are interested in hosting these clinics. Once we find out the schools that are interested, we would connect the vaccine provider with the schools, and then we would collaborate with the provider and the school to move forward with setting up the clinic date, coordinating this event, distributing consent forms, etc. Next slide, please. So this is a summary of the Stop Flu at School efforts that we did last year from 2023 to 2024. So the timeline was held during October through December. That's the typical timeline during the influenza season. However, our clinic operational period commenced in October of 2023 and then concluded in 2024 of February. So we aimed at students. Obviously, the participation is voluntary. It was offered to students in elementary school, middle school, and high school. And then parents and guardians' written consent is always required for vaccination. The school participation is also voluntary. We aimed at targeting public, private, independent Catholic schools and charter schools. And then we partnered with 5 vaccine providers to provide these vaccination events. And we completed 24 school-located vaccination clinics. Next slide, please. So this is a list of the community flu vaccination providers that we partnered with. The 5 would be Kaiser Permanente, which is a community-based organization, PharmaCare, which is a pharmacy, Kalihi Palama Health Center, and Waikiki Health, which are federally qualified health centers. And then Champs Pediatrics, which is on Maui, that's a private healthcare provider. And then we always coordinated with Hawaii Keiki nurses as well in many schools. Next slide, please. This is our list of the 24 completed school-located flu vaccination clinics we did in 2023 and 2024. As you can see, we targeted like elementary schools, middle schools, and high schools. There were public, Catholic, independent schools. Some were on Oahu, and we did some on Maui. And then those are the community vaccination providers we partnered with and the clinic dates. And then Kalihi Palama Health Center, which is a federally qualified health center, also did COVID vaccinations as well as flu. Next slide, please. So our next steps were, like I said, we're in the beginning stages of planning for the 2024-2025 school year. So that would be like planning these clinics for October 2024 through December of 2024. But like I said, it could even go into February of 2025. So we're in the process of sending out our Department of Health school survey to assess which schools would be interested in hosting these clinics. And then we're also performing vaccine provider outreach to get more vaccine providers and to help grow these clinics. So we're seeking community vaccination providers to conduct these clinics. So if you're interested in partnering to do one of these clinics, you can reach out to me for further information. My contact information is there with my email and my phone number. And I think that's it. So if there's any questions, please put it in the chat and I'd be happy to answer them. And I really appreciate you attending this presentation. Thank you.
Hey everyone, thank you for attending. So as Bridget stated, all of our contact information is here as well as hers. So again, she is a community vaccination program specialist. So any questions regarding the flu at school vaccine clinics would be directed towards her. And then any general VFC related questions would be directed towards the VFC QA team. And next slide, please. We also have a survey. If you could, we'd really appreciate the feedback. If you just go to this link, it will direct you to the VFC webinar satisfaction survey. Again, thank you all for attending the presentation today. If you have any questions, please go ahead and put them in the chat and we will answer those. Thank you.